I don't really have a motto as such, but I suppose my general approach to patient care is very much that the patient is in charge. It's their body, it's their life. My job, my role, I see, is to give my expertise. So they're coming to see me for my expert opinion. So it's my responsibility to be a complete expert in the matter that they're consulting me about, and to explain it fully, so that they understand what the diagnosis is, what the various treatment options are, and that I help them to choose the correct treatment for them. But I'm not at all a sort of doctor who likes to tell a patient what they have to do. So it's very much, I'm an expert that they're consulting, and they can then take from my advice what they need to take. One of the most common diseases that I treat in women of the vulva is something called lichen sclerosus. So this is a condition that causes recurrent long-term itch. And often patients come to see me, they've had it for years and years, it's never been diagnosed, and they've sort of been labelled as recurrent chronic candida. So that's one of the most rewarding conditions, because patients often have had itch for years and years. And once I see them and make the correct diagnosis and institute the correct treatment, their symptoms are relieved within days. Sometimes it's absolutely brilliant. It's very, very rewarding. Other conditions, there's a condition called lichen planus, which is similar to lichen sclerosus. I see a lot of patients with eczema and psoriasis. And then in terms of infections, there's a lot of people with candidiasis. Human papillomavirus infection is quite a common condition. I also see people with a lot of pain of the genital area, particularly women who have discomfort during sex. Sometimes the diagnosis is called vestibulitis. So those patients should come and see me, because that's very amenable to treatment. And again, patients have often suffered for years. Some patients not had sex for years. And that is completely treatable. And so definitely patients should come to see me about that, and not just suffer without discussing it with a doctor. And there's some patients I see who want HIV testing for hepatitis B and C, things like that. I'm fully trained to treat male patients. They often have similar symptoms to women, so diseases of the penile skin, so they can have itching, rashes, lumps and bumps, soreness, discomfort. And they often have similar problems. Very often men have eczema or psoriasis of the penis, and they don't think a skin disease is there. So, and although this is the Women's Wellness Centre, we're quite happy to see men here if they have problems that I can help with, yes.